Hello, I'm Dr. Johnson, a specialist in rehabilitation medicine. There's a phrase I often hear in my office. Doctor, I've already had injections, I've taken medications, but why don't I feel any improvement? I guess it must be because of my age. When I hear that, I usually reply, there's still something you haven't tried. Whether it's knee pain or shoulder pain. Many times, by starting treatment at the sole of the foot, we achieve surprising results. In this video, I'll share real-life experiences I've gathered over 3 decades of treating patients, including the story of an elderly man who was able to stop using his cane in just 2 weeks. If you stick around until the end, I guarantee your perspective on pain will completely change. Do you struggle to get out of bed in the morning because of back pain that makes it hard to stand up straight? Do your knees hurt so much when climbing stairs that every step feels like a real challenge? Do you have trouble sleeping because of shoulder pain? Do your finger joints hurt so much that you can't even hold your grandchild's hand? At the hospital, they just tell you it's due to aging. You take medicine and feel no improvement. You get injections, and the relief is only temporary. You begin to wonder if you'll have to live with pain forever. That frustration, that sigh, that feeling of giving up, I understand it completely. I've heard many similar stories from patients in my practice. But today, your perspective is going to change completely. The most amazing thing I've discovered in my 30-year medical career is that sometimes the answer to chronic pain is so simple that people overlook it. One of the most effective techniques is what we call the foot patch method. Yes, at first, it might sound strange. Why apply a patch to the sole of the foot if what hurts is my knee? And what if the pain is in my back? I had my doubts in the beginning too, but after trying on thousands of patients, it's now the first approach I recommend to those suffering from chronic pain. This method isn't just another health tip. It's a remarkable discovery that has already transformed the lives of thousands of elderly people. And the best part? You can start right away from the comfort of your home, and it only takes 5 minutes. An 83-year-old man once told me, "Doctor, I suffered from back pain for 2 decades, but after applying the patch to the sole of my foot, I stopped using my cane in just 2 weeks. My wife keeps saying I look younger. How is such a dramatic change possible?" The reason modern medicine often fails to relieve chronic pain is that most treatments only target the symptoms, not the root cause of the problem. Painkillers offer only temporary relief. Injections merely reduce inflammation partially, but they don't restore the body's balance. The foot patch method is different. It taps into the body's essential network of connections. Our body is interconnected, with each part influencing the others. The sole of the foot plays a key role as a control center of the entire body. Today, I'm going to explain this incredible method in detail. If you watch this video until the end, you too can break free from pain and start a new chapter in life. The best part is, this method has almost no side effects. It's very affordable, and anyone can do it with ease. Now, let's begin. The fascinating story of the foot patch. The first story is about Jack Gray, an 85-year-old man living in Yongin, Gyeonggi-do. For 25 years, he suffered from arthritis in his knees. The first time he came to my office, he was in a wheelchair. Both knees were severely swollen, and not only could he not walk, he couldn't even stand without feeling pain. He had undergone 3 surgeries and received over 20 injections, but the results were always unsatisfactory. He was about to give up. That's when I explained the foot patch method to him. Naturally, he had doubts at first. Why apply a patch to my foot if the pain is in my knee? I told him, just try it for 3 weeks. And exactly 3 weeks later, when he returned to the hospital, he looked much better. He walked in by himself, no longer in a wheelchair. "Doctor, it's a miracle," he said. At first, I didn't feel any change, but starting around the 10th day, the knee pain began to lessen significantly, and after 3 weeks, it was almost completely gone. Now he takes 30-minute walks every morning and even tends to a small garden. My grandchildren couldn't believe it, he said. They told me I look younger. This grandfather's transformation wasn't just about pain relief. It was about reclaiming a daily routine he had lost for 25 years. Tending the garden, playing with the grandkids, going on walks with his wife. All of these everyday activities felt like a true miracle to him. One example is that of Mrs. Kate Black, a 72-year-old resident of Seoul. She suffered from a herniated disc in her back for over 10 years. On one occasion, she remarked, "I entered the hospital leaning on a cane, but after using a patch on the sole of my foot for just 3 days, I walked out without it. Even the doctor was amazed. At first, she was skeptical that a patch on the sole of her foot could relieve back pain, but in just 3 days, she noticed a significant change." Mrs. Park's case is one that showed particularly fast improvement. Before we continue, don't forget to like the video if you're enjoying it, and subscribe to the channel to receive the best tips on how to attract abundance and prosperity into your life. Let's keep going. Of course, not everyone sees such immediate results. However, more than 80% of patients notice clear improvements within 2 weeks. Mr. Paul Smith, a 79-year-old resident of Daegu, suffered from shoulder pain for a long time, particularly from what is known as frozen shoulder, which even prevented him from raising his arm. He experienced discomfort while washing his hair or getting dressed and couldn't lift his grandchildren when they asked. However, after he started using the patch on the sole of his foot, in just 2 weeks, he was able to move his arm freely. Now, he even plays badminton with his grandchildren. Mrs. Natalie Payne from Gwangju suffered from rheumatoid arthritis for more than 40 years. Her fingers were twisted and painful, making it difficult for her to do things like sewing or using chopsticks. Doctors at the hospital told her it was a condition she would have to live with permanently. Can you imagine how disheartening it must be to hear the phrase "for the rest of your life"? After applying the patches to the soles of her feet for 3 weeks, something amazing happened. Now Mrs. Natalie makes clothes for her grandchildren with her own hands. She began using the patches due to knee pain, but also noticed a remarkable improvement in the discomfort in her hand joints, which shows the widespread effect of the foot patch. These cases are not mere coincidences. Thousands of people across the country are experiencing similar situations. Among the patients I have personally treated in the clinic, nearly 78% reported significant pain relief thanks to therapy using patches applied to the soles of the feet. So, what do these people have in common? First, they didn't find significant relief with traditional treatments. Second, although they were initially skeptical about using the patch, they decided to give it a try. Third, most people noticed clear improvements in just 1 week. Fourth, the benefits continue to appear over a period longer than 3 months. You too could notice these results, just like those who have already tried it. The key is to take the first step now. So why is the patch applied specifically to the sole of the foot? How can a patch placed in that area relieve discomfort in the back, knees, or shoulders? It's time to reveal that amazing secret. Everything in the human body is interconnected. In particular, the sole of the foot can be seen as a microcosm that interacts with the entire body. This is not just a metaphor. It's a scientifically supported fact. There are more than 7,000 nerve endings in the sole of the foot that are directly linked to different organs and body parts. It functions as a sort of control center. This is the main reason why patches applied to the sole of the foot can have effects on distant areas like the knees or back. Traditional Eastern medicine has used this knowledge for millennia through the concept of reflex points on the sole of the foot. Stimulating specific points in this area helps improve the functioning of related parts of the body. For example, the center of the sole is connected to the spine. The inner edge is associated with the side of the spine. The the side with the arms and legs, and the area under the toes connects to the shoulders. One particularly important point is Yangqin, located just above the center of the sole. In traditional Chinese medicine, this point is identified as our one within the kidney meridian and is considered essential for controlling pain and inflammation throughout the body. Applying a patch in this area enhances the flow of qi or vital energy and helps reduce inflammatory processes, especially in muscles and joints. From the perspective of Western medicine, the sole of the foot also has particular importance, as it presents three fundamental characteristics. It represents both the final destination and the starting point of blood flow, since it is the furthest area from the heart. It's where blood tends to stagnate before beginning its return. Stimulating circulation in this area promotes better blood flow throughout the entire body. 2. Due to the effect of gravity, toxins tend to accumulate in the feet. Activating this region facilitates their elimination, which helps to reduce overall inflammation in the body. 3. The skin on the sole of the foot is thin, making it easier for patch's ingredients to be absorbed. This is especially true in the Yangqin area, which has minimal subcutaneous fat and a high concentration of blood vessels, allowing the patch's components to be rapidly absorbed and distributed throughout the body via the circulatory system. Active compounds such as capsaicin, salicylic acid, and menthol easily penetrate the thin skin, acting directly on areas affected by pain or inflammation. A study conducted in 2022 by researchers at the University of Tokyo showed that stimulating the sole of the foot can relieve tension in other parts of the body thanks to the interconnected facial network. This network is made up of tissue that envelopes the entire body, allowing pressure applied to one point to produce effects in distant regions. Additionally, such stimulation promotes the production of endorphins, natural substances that help relieve pain. In fact, further research revealed that endorphin levels in the blood increased by up to 40% just 15 minutes after stimulating the sole of the foot. This is precisely why many people experience a general sense of well-being after applying these patches to their feet. Another important reason to apply the patch to the sole is its ability to improve blood circulation. One of its ingredients, capsaicin, helps to dilate blood vessels and stimulate blood flow. As a result, the delivery of oxygen and nutrients to tissues increases, aiding in their repair and regeneration. This process is particularly beneficial for joints, where blood flow is often limited. Improving circulation in these areas can be key to relieving pain. Moreover, the salicylic acid in the patch has powerful anti-inflammatory properties, similar to those of aspirin, helping to reduce inflammation throughout the body. Menthol, meanwhile, provides an instant cooling sensation that reduces the perception of pain and offers quick relief. From both scientific and traditional medicine perspectives, the effectiveness of applying a patch to the sole of the foot is well documented. However, there is a key factor. All these benefits depend on correct placement and application. It doesn't have the same effect if applied anywhere on the body. Choosing the right spot, the appropriate timing, and the correct type of patch is essential. So what steps should we follow? I'm going to explain the specific procedure. You can have a pen and paper handy to take notes, or simply save this video. What matters most is that you put it into practice tonight. First, I will clearly indicate the precise points where you should apply the patch depending on the area of pain. For knee pain, place the patch in the center of the sole of the foot, slightly toward the heel. This point is known as gallio. Keep in mind, if only one knee hurts, it's still important to apply the patch to both feet for better results. Mrs. Natalie Manja mentioned that at first, she only applied it to the foot on the affected side, but when she used it on both feet, the results were much more effective. To relieve lower back pain, place the patch in the center of the sole. When you flex your toes, you'll feel a depression in the area. That point is known as Yangqin. If you suffer from a herniated disc or lumbar pain, focus on this point. You can also place another patch in the center of the heel to enhance its effectiveness. Mr. Lee Tae-jun shared that his back pain, which had troubled him for 20 years, improved significantly in just 2 weeks, and he was able to walk without using a cane. To relieve shoulder pain, place the patch just below the big toe and also below the little toe. If you have frozen shoulder or adhesive capsulitis, it is recommended to use a slightly larger patch on the foot corresponding to the affected shoulder side for better results. Mr. Choi Byung-ho was so satisfied that he said that after 3 weeks, he could already play badminton with his grandson, something that had previously been impossible, as he couldn't even lift his arm to touch his head. To relieve neck pain, apply the patch about 2 centimeters inward from the space between the second and third toes toward the sole. This is particularly beneficial for those who suffer from neck stiffness due to excessive cell phone use. Before applying the patch, there is one preliminary step. Thoroughly clean your feet and make sure they are completely dry. Soaking them in warm water for about 5 minutes will stimulate blood circulation and enhance the patch's effectiveness. If there is any moisture left, the patch won't stick properly or work as efficiently. So dry your feet well with a towel is essential. What type of patch should you use? Most patches sold at pharmacies are effective. It's recommended to choose products that contain the following ingredients. Capsaicin promotes blood circulation and relieves pain. Salicylic acid has a notable anti-inflammatory effect. Menthol provides a refreshing sensation and offers immediate pain relief. Natural plant extracts reduce side effects and prolong the duration of the benefits. Just tell the pharmacist that you need a patch to relieve muscle or joint pain, and they will suggest the most appropriate one. I'm going to recommend a product. It doesn't have to be an expensive one. What really matters are the ingredients and the area of application. When and for how long should it be used? This is crucial. Remember that the best time to apply it is before going to bed, at night. The body enters a recovery phase, which helps the patch's ingredients absorb and work more effectively. The most recommended time to apply it is between 9 and 10 p.m. It should be left on for 8 to 12 hours. Apply it before sleeping and remove it upon waking. Avoid leaving it on for more than 24 hours, as it could cause skin irritation. Regarding how often to apply it, during the first week, it's ideal to use it every night. After that, you can apply it every other night. Most people start noticing changes between the 3rd and 4th day, but for persistent pain, it must be used consistently for at least 3 weeks to achieve full results. Grandma Huang Myong shared the following. At first, I didn't notice much difference in the first 3 days. I almost gave up, but starting on the 5th day, I really saw the change. Now, after 3 months of use, the pain has almost disappeared. Some people should take extra precautions. If you have diabetes, be sure to check your feet thoroughly every day. If you experience redness or itching, stop using it immediately and consult your doctor. If you have sensitive skin, first test a small area and never apply it on open wounds. Also, I'd like to share a few simple habits that can enhance the effect of the patch. From this moment on, it's important to pay attention. These tips can double its effectiveness. First, make sure to drink enough water. Drinking more than 8 glasses a day helps distribute the patch's components better throughout the body and assists in eliminating toxins. Many older adults don't drink enough water, which significantly reduces the patch's effect. Drink a glass of water with every meal, plus 1 in the morning, 1 in the afternoon, and 1 more in the evening. Second, do ankle rotations when you wake up. While sitting on the bed, rotate each ankle 10 times to the right and then to the left. It's an exercise that takes less than a minute, but improves circulation in the feet and enhances the patch's effect. Third, take gentle walks. Move as much as your pain allows. It's the best medicine. Start with 5 minutes and gradually increase. Using the patch along with walking speeds up the healing process significantly. So, Do you know what your next step is? Let me summarize it for you. Wash your feet and dry them thoroughly. Place the patch on the area of discomfort. Leave it on for 8 to 12 hours and remove it upon waking. During the first week, use it daily. Afterward, apply it every other day. Stay well hydrated and do light exercises. By following these 5 simple steps, you will notice a significant improvement and can finally leave the pain behind. Would you like to hear real testimonials from people who achieve deep, lasting change thanks to this? In the next section, I'll show you powerful stories from individuals whose souls underwent a complete transformation. Truly inspiring experiences await you. From this point forward, I'll begin sharing authentic stories from patients I had direct contact with in the treatment room. Listen how their lives change, and imagine the future you could also have. This transformation is within your reach. Mr. Lee Sangchol, a resident of Busan, worked as a bus driver for 35 years before retiring. During that time, he suffered from severe pain caused by herniated discs in his spine. He couldn't sit for more than 10 minutes. An MRI revealed he had, after regularly applying a patch to the sole of his foot for 2 months, he noticed an incredible improvement. Now, he can spend long periods sitting with his fishing rod, and his favorite activity is escaping to the sea every weekend with his grandchildren. Despite doctors' recommendations to avoid exertion, he has even resumed gentle hikes on nature trails. Just like with this man, the foot patch not only relieves discomfort, it can radically change your quality of life. You, too, will soon experience this change. Mr. Jong Byung-ho, 81 years old and originally from Jeonju, dedicated his entire life to farming. Due to spinal stenosis, walking had become nearly impossible for him. After walking just about 100 meters, his legs would go numb and he would need to rest. When his son suggested buying him a wheelchair, he couldn't imagine how humiliating that felt. He thought, "Is this what awaits me after working all my life in the fields?" But after consistently using foot sole patches for just 3 weeks, Mr. Jong noticed an astonishing transformation. Now he takes a half-hour walk each day, enjoys reading, and has resumed tending to his garden. Who would have thought such a simple patch could bring such a remarkable change, he says with a laugh. All my friends are using them too. They even sold out at the store in our neighborhood. I conducted a study with 100 participants, and the results were remarkable. 78% reported experiencing less pain. 65% said their sleep improved significantly. 82% mentioned an increase in their daily activity levels. And 91% said they would recommend it to others without hesitation. One of the most moving experiences took place in a senior care home in Gwangju. 5 residents who relied on wheelchairs had patches applied to the soles of their feet over a 6-week period. As a result, 3 of them were able to walk using a walker, and 1 was even able to move around on her own, though only for a short distance. The center's director commented, "They didn't just experience physical improvement. Their expressions changed completely. They went from a mindset of all over to a renewed hope of there's still a chance." The real benefit of these patches lies not just in pain relief, but in the opportunity to reclaim a life that once seemed lost. Activities that have been set aside, friendships forgotten, places they could no longer visit, all of that is now accessible again. You, too, can experience this transformation, just like the people I mentioned. That's why I sincerely encourage you to try it tonight, right before bed. Just imagine the changes you might see in only 3 weeks. It could completely change your life. To conclude, I'd like to share some habits that can maximize the benefits of foot sole patches, along with answers to common questions. If you stay until the end, I'll even reveal some secret tips to boost their effectiveness, perhaps even double or triple it. With this information, you may be able to reduce the need for frequent hospital visits. While the patches work wonderfully on their own, Combining them with certain habits can make the effects even more powerful. These tips come from my experience treating thousands of patients over more than 3 decades. First of all, staying well hydrated is essential. I recommend drinking at least 8 glasses of water a day. This is especially important for older adults who often don't feel as thirsty and therefore don't drink enough water. Water plays a key role in helping the patch's components circulate effectively through the body. Without enough water intake, the patch's effectiveness may be significantly reduced. Mrs. Park Sunja, 81 years old and a resident of Jeonju in Jeonnam Province, shared, "Ever since I started drinking more water, just as you advised, I've noticed a huge improvement in the patch's effects. Now, before going to bed, I make a habit to apply the patch and drink a glass of water. Secondly, opting for an anti-inflammatory diet is very beneficial, including foods like ginger and turmeric, known for their anti-inflammatory effects, as well as omega-3 rich fish like mackerel, horse mackerel, or sardines, which are excellent sources of antioxidants. It is also recommended to consume berries, leafy green vegetables, nuts, and olive oil. It is also suggested to reduce the intake of certain foods, such as refined sugar, flour, processed foods, cured meats, and those containing trans fats." Mr. Choi Dong-chul, a 79-year-old man from Seoul, experienced a remarkable transformation after adopting an anti-inflammatory diet along with using foot patches. "After modifying my diet and starting to use the patches, I noticed that the results have multiplied. Now, I almost don't need to resort to painkillers." Third, stretching in the morning really works. Just 5 minutes of basic stretching before starting the day helps maintain the benefits of the patch. The following exercises are particularly recommended. Ankle rotations. Slowly rotate each ankle 10 times clockwise and another 10 times counterclockwise. Toe stretches. Flex and extend the toes 10 times. Foot massage. Gently roll a tennis or golf ball under the sole of your foot. Mrs. Lee Jong-suk, 72, a resident of Ulsan, commented, "By dedicating just 5 minutes each morning to rotating my ankles and massaging the soles of my feet, I noticed that the patch's effect lasts considerably longer. I almost no longer experience knee pain." Fourth, walking correctly also plays a crucial role. Walking gently for 20 to 30 minutes daily promotes circulation and tones the muscles. If combined with the use of patches, the effect is even more noticeable. Start with just 5 minutes a day and gradually increase. Mr. Natalie Young-ho, 76, a resident of Busan, shares, "At first, I only took a few steps to the door of my house, but now I walk for 30 minutes on the beach every day. Back discomfort has almost disappeared. The combination of using the patch and walking really enhances the effect." Fifth, it is crucial to maintain proper posture when sleeping. If you experience back or knee pain, sleeping on your side with a pillow between your legs can help. If you have neck discomfort, use a pillow that provides good support for the cervical vertebrae. Now we will answer some frequently asked questions. Can the patches cause side effects? In general, they are safe. However, people with sensitive skin may experience itching or redness. If this happens, remove the patch immediately and try applying it to a smaller area after 2 days. If discomfort persists, stop using it, especially if you have diabetes. Check your feet daily. If you notice any changes in your skin, stop using them and consult your doctor. Are there alternatives to the patch? Yes, massaging the sole of the foot with essential oils like peppermint eucalyptus or lavender can also be very helpful. It is especially beneficial if done after soaking the feet in warm water before bedtime. However, the effect may not be as intense as using the patch. When do the effects start to be felt? Generally, people notice changes within 3 days to a week. However, if the pain persists, Full recovery can take anywhere from 3 weeks to 3 months, depending on the individual. The key is consistency. What is the best patch? Patches containing capsaicin, salicylate, or menthol are quite effective. At the pharmacy, you can ask for a patch to relieve joint or muscle pain. It doesn't need to be an expensive option. Can I use patches along with my medications? Yes, it is possible to use them alongside your current medications. Many patients have been able to reduce the amount of medication once they started using the patches. But do not stop taking your medication without first consulting your doctor. Finally, a few sincere words for those who have made it this far. Pain is not limited to physical discomfort. It also affects our ability to enjoy, to feel happiness, and to find meaning in life. Don't tell yourself, "I'm too old, I just have to resign myself." If you put into practice what you've learned today, not only will you be able to relieve the pain, but you'll also rediscover the genuine passion for being alive. One of my patients expressed, "When the pain disappeared, my will to live returned." From the bottom of my heart, I hope you too experience a day like that. Start today. Before going to bed tonight, place the patch on the sole of your foot. And don't forget to share this valuable information with your loved ones who suffer from pain. You could change someone's life. I tried it too, and it gave me good results. If you have questions like which patch is the most recommended, or want to share your experience, I would be happy to hear them. I will respond to each one with pleasure. Thank you.